Buddy, and welcome to Provider Resilience. This is a short series I have for um, components or short sessions for this. And we're going to start today with part one and provider resilience. And I created this back during the pandemic because we were, of course, having just a lot of issues and a lot of provider turnover and stuff. And so the subheading, "What do you mean it's not over yet?" was appropriate then. Probably right now, I would say something like, "When do we get a break?" Or, "Why am I feeling as bad as my clients these days?" Those sorts of things. So let me go ahead and run through this with you. We're a small enough group that if you have questions or comments, by all means, just speak up and let me know. Feel free to unmute yourself and join the conversation. The way I was looking at it, we had three major issues that we need to be aware of and deal with. Secondary traumatic stress, of course, is what we are exposed to when we learn about other people's traumas and stress. Primary traumatic stress is when we have our own personal history of trauma and or chronic stress. And now that we've lived through a pandemic, we do have our own personal history, no matter what. And if you're living in the United States right now, there's a lot of chronic traumatic stress just happening in general. And then we, at the time, we're having a workforce crisis. We don't hear about that as much anymore, but it is still an issue, and many, many places are understaffed. So these are the things that we're going to take a look at today. Okay, so let's start with secondary traumatic stress. The emotional duress that results when an individual is exposed to the firsthand trauma experiences of another. And if we're in the treatment business, then that's what we're working on. And so, of course, we hear those stories. We're hearing everybody's trauma all the time and sometimes seeing it. And I think the thing that I want to help you understand is that secondary traumatic stress symptoms are the same as any other kind of trauma symptoms and the same as PTSD symptoms. Okay. So just because we call it secondary doesn't mean it isn't as impactful or problematic. And I want you to understand that. And as a matter of fact, as treatment providers, we are exposed to more trauma and stress than most people are. And then if you're a supervisor of other people who are doing treatment or providing services, you just multiply the amount of secondary traumatic stress that you're exposed to. And just because it's called secondary does not mean that it's any less than or doesn't impact us in some of the same ways that firsthand trauma does. So let's look at this. Who exactly is at risk for secondary traumatic stress? Well, child welfare workers are right at the top of the list because they're going in actively when some of these things are happening. So for good reason, you can understand why that's happening. Therapists, counselors, social workers, there we are, right up there with them. People who are particularly empathic, they feel for other people. Sometimes they can't not feel for other people. And you know where those people go? Into services. They're us, folks, and they want to help. And so they end up with this exposure as well. People who are doing the work but have unresolved personal trauma. If you haven't taken care of your own history and any exposure that you've gone through, then you're at extra risk. People with heavy trauma caseloads. Now, this is kind of a funny part because I no longer know anyone who doesn't have heavy trauma caseloads, right? This was in this list like this before we realized that virtually very close to 100% of the people that we work with have trauma histories. And that's why ultimately they're finding their way to these sorts of services. So we used to think that we could say, reduce your trauma caseload and do some regular treatment, then it'll keep you balanced. But it just doesn't really split out that way anymore. And finally, social or organizational isolation. That, of course, was heavy during the pandemic, but a lot of people now are doing virtual treatment. And so, unfortunately, that leaves you in a rather isolated space doing your treatment, unless you're aware of it and augmenting it with professional meetings like this one, um, and other ways that you're connecting with people, so that you don't feel so socially or organizationally isolated. Sound like anybody you know? Here is a list of common stress symptoms. And there are others that we could mention, like dismissive positivity, numbness, being unmotivated. If you can think of other symptoms that ought to be on this page or in this activity, by all means, drop them in the chat or unmute yourself and say them. But we tried to pull together a bunch of them. And the question becomes, how many symptoms have you experienced in the last 30 days? So without revealing to us which symptoms you've experienced, get a number. How many of these have you experienced in the last 30 days? Have you been hypervigilant, hopeless, unable to embrace complexity, inability to listen? You think you're listening and then you realize, oops, I spaced out there. Avoidant clients, like, are you ever happy when they cancel an appointment? Woohoo! I don't have to deal with that right now. Anger or irritability that you can't seem to keep a handle on. Being cynical about everything. Boy, that's a hard one to knock off anybody's list right now. Decision overload. Feeling like, and I mean like I can't make a decision sometimes about dinner. I don't mean about big things. I just am like, ugh, I do. Oh, I just noticed it this morning actually in myself, deciding what to wear. This should be a no-brainer. I'm in my 60s. I've been dressing myself for quite a while. And I'll stand there and think, no, I don't know. And I'm not even that stylish or care that much about it, but that I see myself stuck. And so it's not the big decisions necessarily. It's daily decisions. Do you find yourself kind of stumped? Any sleep issues? Sleeping too much, sleeping too little, disrupted sleep. And ladies, if you're anywhere near menopause, peri or post, we're going to have those anyway. So that's a double whammy on the sleep issues. Generic fear of things, feeling exhausted. Physical ailments popping up. Minimizing things, feeling guilty about things. Experiencing or having flare-ups around chronic pain. And finally, what was dubbed COVID brain, which is just having a bunch of these interfere with clear thinking. So if anybody can identify any others, I'd be, oh, I see there's something in the chat. Let me get to it. Oh, you're doing your numbers. Thank you, everybody. And so again, without revealing which one of these you're struggling with, I'm not trying to get you to expose yourself more, but how many of these things are you personally experiencing, well, within the last 30 days? Anybody else? There we go. How many people do we have? 20. I think it's helpful to see that other people are also experiencing not just one or two of these things, but it looks like this crowd is in the 6 to 9 range. Thanks to those of you who participated and put it in the chat. it's not nothing. I'm kind of pushing you to do this because we often don't count ourselves when we're thinking about these things. We're real good at diagnosing other people with some of these problems or symptoms, but not so much at recognizing it ourselves. So let's look at chronic traumatic stress for a minute. What is contributing to our stress? Well, that pandemic really made massive changes in all of our life domains, and we need to acknowledge that. But post pandemic, we're still experiencing some of these things. And oops, I probably should have done this. Here we go. Massive changes in our life domains, divisive tensions. That's one that is certainly existing now, and we have a lot of polarized things polarizing things going on in our environment these days. And I've spoken to a fair number of clinicians lately who are struggling with treating people who don't land on their side of the polarizing, and how to be present and supportive of people when you know that they fundamentally don't have the same values or think about things in the same way that you do. And this wasn't always the case for us. We were sort of able to separate so compartmentalize, if you would, some of our personal stuff to be able to work with clients who don't necessarily think the way we do, or what do I want to say, resolve things in the way we're encouraging them to do so. So lots of divisive tensions going on right now. Online exhaustion for those who are doing a lot of online stuff. I definitely am. And with activities even like this. And I think the only thing I can say about that is that you should also do things that aren't online. We found out how easy it was to link up with others and to do things and trainings and even sessions online. And it's been hard to let go of that because it allows us to reduce time out of the home. It allows us to participate in things that you can access online. But the more we do online, the harder it is for us to connect with real people. And it can be difficult to interpret everything that's happening online sometimes. Anticipatory anxiety about what might happen, what might be lurking outside your door. One of the things that I've said to people recently is we've spent, most of our careers telling people there is no tiger outside your door. And unfortunately, there are active tigers roaming our streets now. And so the anticipatory anxiety is higher and higher these days. And it's your brain trying to prepare you for worst case scenarios. Does anybody else besides me spin into horrible imagination? Honestly, I call them my Stephen King moments, and where it's just like I think of the worst possible thing that could happen in the next few moments, and I don't need to do that. I wish I could let go of that, but that's what anticipatory anxiety really is imagining the worst. And finally, our own loss and grief. And really, people have repetitive experiences of loss and grief. It's a part of life. And when we lose a connection, or we lose health, or we lose parents, I mean, nothing seems easy when we're sort of in that loss and grief kind of things. And even if we get out of it, it's going to revisit us. So how do we deal with all of these things? These are the contributors to chronic traumatic stress. Then the workforce crisis, that people are understaffed. What I see a lot of right now is this chronic turnover. We did manage to help people in my organization. We worked on helping people with staffing, particularly in intensive home-based work. But then what's plaguing agencies now is chronic turnover. And people are jumping from one agency to another agency, hoping that it feels better, hoping that they make an extra dollar, hoping that they have a better supervisor. For whatever reason, the turnover occurs, it's happening. Wage issues, feeling like you're in an environment that isn't supportive enough. But if you're in a virtual environment, you're probably not getting any kind of direct support. And protection. I'm trying to think about why I talked about the protection, but the other thing I've had a lot of requests for lately from organizations is, can you tell us how to stay safe out in the communities? So, because we work with a lot of people who are doing intensive work out in the communities, and how do they protect themselves from things that are out there? So we're all exposed to a lot of this stuff, and we sometimes are finding it harder to recruit people to come and do the work we're doing because of these issues, and they think it's got to be safest to just be online. So many new providers and clinicians are just wanting to go that route, and while that works for some people to receive virtual treatment, there are a whole slew of people who really need a more personal interaction and would do better that way. But we're running out of people who are seeing others in person. So let's talk about the solution. I'm here to talk about resiliency, right? Not just the problems, but I just wanted to show you how this is all stacking up against us and why we need to be so resilient. And the first thing I'm going to say is that we need to activate our polyvagal network. Okay, so we have this nervous system in us, and we know more and more about it. The neuroscience research has just exploded over the last decade or two, and they have a lot to say about it. But we really want to work on the resilient side of things, and so I want to talk a little bit about your polyvagal nerve network, or otherwise known as the social engagement system. So let's talk about them one by one. Tune in to how your body is feeling. Okay, when you're feeling stressed, tune in to your body feelings, not just your head and what you're thinking about, but how is your body feeling? Use your breath, because mindful breathing can be a very powerful way to self-regulate. If you do any kind of breathing meditation or work, any kind of breath work, you probably are in a position or a place where when you recognize tension or stress, simply taking a couple of deep breaths can ease that a little bit. Okay, if you're allowing yourself to do that. Connect with other people. If there's no one to actually socialize with, then you should visualize someone that you trust and like. And even pets, connecting with pets can have a very similar neurological positive response. So that can be very helpful as well. But connecting with people, and remember, your polyvagal nerve network is considered your social engagement system. But the interesting thing I want to tell you about is that you can do that just through your imagination. It doesn't have to be an actual connection. Now, is an actual connection best? Yes. Find a friend, do something with them, call somebody you like or trust. But if you don't have anybody that you can get to, just visualizing them can be helpful. And finally, harness that anxious thought. Don't let it run into a Stephen King scenario for yourself. So if you're feeling anxious about something, recognize this is an anxious thought. I don't need to be doing this right now, and literally steer your thinking into another direction. Activating this polyvagal nerve network, can have a snowball effect. When you start to activate your connection or social engagement system, it activates your entire ventral vagus nerve, which activates, by the way, your prefrontal cortex. Okay, so it's up here, and ventral vagal means that it's in the front of your body. It's coming down through your body, and it can really calm you. The part of the brain that deals with logic is up in your prefrontal cortex, and you can't get to it if you're super anxious. You have to be relaxed. If you're super anxious or scared, literally scared about something, you can only access the lower parts of your brain. You aren't getting up into your cortex, and including your prefrontal cortex. So doing these things allows you to activate and have access to that social engagement system and your prefrontal cortex. And those are the parts that deal with things for you or might have ideas for you. Calming yourself allows you to think clearly and process your difficult circumstances or whatever it is you're worried about, which will further resolve the stress in your body. We should all learn more about the polyvagal activation, but time is short. So for today, let's go on to 4 quick things that you can do. Number 1, step out of that anxious narrative and check in with yourself. Just hit pause. When you can detect that you're anxious or you're not feeling your best, hit pause and see what kind of options you might have. Do the same things I just talked to you about. Take a deep breath, because that literally starts activating your parasympathetic nervous system. Help someone else. I find this to be the most interesting, quick thing that you can do. And it works kind of magically. I found that I can take a kid who's melting down and falling apart and ask them to do somebody a favor or to help me with something. And it's like a switch flips. And the really cool thing about helping someone else is that you both get a shot of dopamine. You feel good because you're helping. They feel good because you've let them help you or encourage them to help someone else, or they just feel good because somebody cares enough to help them. And so double shot of dopamine when people are helping each other. And I find it as a really interesting intervention in family work and working with youth, that they can literally turn on a dime and be like, oh, you need something done? I want to help. And it reminds me of I ran residential camps for behavior disordered kids. And I'd walk into that dining hall and say, I need some help moving all this firewood down to the blah, blah, blah. And I mean, all the arms shoot up. They all want to be helpers. And these are kids who are in trouble with behavior disorders, and they're still wanting to be a part of that and to help out. And the last one is shake it off. So shaking your body is really helpful. And a lot of people don't like it because they think it looks silly. They don't want to have to do it with or for their clients, those sorts of things. But literally shaking your body, moving it a lot, completes the stress cycle. If you, I don't know that anybody's ever been able to witness this, although you could on like different TV stations or channels about animals. When an animal gets struck or knocked down, they sort of automatically go into like possum mode, and it's like they fainted or can't get up yet. But when they do, what's the first thing they do? They shake it off. And shaking is a way to calm your nervous system, and it takes you back to being a more in control and healthier moment. And so shaking things off can be very helpful. With the kids that I was working with at that camp, we called it wet dog. You know how a dog will get out of the pool or out of the bath and shake everything off? And so I could get them to play around with that concept of the wet dog and shaking, shaking, shaking. Here's the catch, though. If you really want it to be clinically impactful, you need to do it for at least 2 solid minutes time to ask people to shake. Another way that people can do it, though, is a dance party kind of thing. And what I like to do when I have people do the shake activity is I usually have a song loaded, something that I know is going to take between 2 or 3 minutes and has a pretty fast beat to it. And then I have people get up and start shaking. I start by having them shake their arms and then wiggling their body and then shaking one leg with it and then another leg with it and then shaking all over. But again, the dance party could work in a very similar way if you actually get people out of their chairs to dance. And when they do this shaking for a solid 2 minutes across the board, they feel attuned, they feel buzzy, they feel definitely less anxious and stressed. And it's a positive sensation. So these might seem like, I don't know, funny things to do with people, but all four of these things can really help you neutralize whatever stress or problem is going on. And if it doesn't solve it, it lets you start thinking about more options and how to deal with this. And so that is actually the end of this little presentation.